to you, and welcome to the Friday Five here on the Agent Survival Guide podcast. This is our weekly list of 5 things you should know about. I'm your host, Sarah Ruppel, and today is May 1st. You know, back when we first started this show, it was a means to share information while agents were out on the road, driving from appointment to appointment. We've certainly come a long way since then. And I don't know about you, but when I'm on the go and on the road, I've got to have something caffeinated to keep me going. So I do get a little bit excited when new drink menus come out for the season. But rather than talk about all of the drinks that are coming out, which we will link to in the notes, I'm just going to highlight my picks here today because we have got a lot to get into in this episode. So new drinks are coming to Starbucks on May 11th, and I am super excited for the return of horchata in both the syrup and the cold foam. I love swapping out my salted caramel cold brew for a horchata cold brew in the summer. But also new this time around, the Tropical Butterfly Refresher brings butterfly pea flower to Starbucks. And while the flavor of butterfly pea flower is fairly mild, I find it similar to chamomile. It's mainly the aesthetic that people order it for. The tea is naturally pH reactive, so depending on the pH balance of the base of your drink, it can turn blue, purple, magenta, pink, or a fun gradient of those colors, depending on the mix and the pour. Very similar to how you can change the color of your hydrangeas by changing the pH of the soil. The new refresher mixes passion fruit, guava, and butterfly pea flower with mango pineapple pearls. Now, over at Dunkin', there are a lot of new coffees for summer, of course, but what I am most excited about from Dunkin' is their new refreshers. There is a black cherry refresher. There's a limeade refresher. And then if you mix the two together, there's the cherry lime Ricky refresher. All of those flavors scream summer to me, but especially the cherry lime flavor, and I always get my refreshers sparkling. Now, Dunkin's summer menu has already gone live, so if you are out on the road, maybe you're headed to one of our road shows or one of our other in-person events, consider this your excuse to stop in, grab a little caffeine, or, just a little drinkable sweet treat as you're out and about. And if you're wondering if a road show is coming to a location near you, check out our events page for dates and locations. That is linked in the episode notes. Moving on, and I should say possibly hopping in our time machine to go way back to the prehistoric era, as my daughter would call it. In that time frame, I was an undergrad majoring in professional writing, taking my senior seminar, and during this class, we read our way cover to cover through the AP Stylebook. Each week, we would be assigned pages, usually 2 or 3 letters of the alphabet, depending on what those letters were. And then we were quizzed on the contents of those pages. And in typical college fun, it was something like 10 to 20 questions on the quiz versus a conservative 150 to 200 terms. I don't recall any of us ever getting very impressive grades on those quizzes, but I made it through the class, made it through the program, got my BA in professional writing, and I still have my copy of the AP Stylebook I used during that class. Can't say that I reference it too much these days, but I did use it frequently when I was starting out in the field, and I think that was the real lesson. Teaching us where and how to source information. This week, I got a little blast from my past mixed with our industry when the new AP Stylebook Committee announced that healthcare is now officially one word. They've been answering the question, is healthcare one word or two, for a couple of years now, and it is official, one word, healthcare. They also made the same decision on childcare and daycare. Now, that is not the only interesting takeaway that happened in that meeting, but it is definitely the only one that applies to insurance. So we will keep moving forward on to our next segment. Spotify made a big move to distinguish itself from its competitors this week. On Monday, the streaming platform announced the addition of fitness workouts and a very lucrative partnership with Peloton. Spotify has had video capabilities for quite some time now. It's a feature I have not really used personally because I'm usually doing something else while I'm listening. But one of those somethings else happens to be while working out, either at home or at the gym. And I've often listened to workout playlists on Spotify. Makes a lot of sense. And my guess is they would not have made this move without looking at their own data and seeing the popularity of those playlists. Free and premium users will gain access to fitness workouts from wellness creators like Abby Mills Wellness, Caitlin Chieli Yoga, Chloe Ting Home Workouts, Pilates Body by Raven, Sophie Reed Fit, Sweaty Studio, and Yoga with Cassandra, to name a few. And then the Peloton part of the equation comes into play for premium Spotify subscribers. If you have a premium subscription, you'll be able to access the Peloton Fitness Library, which will include over 1,400 classes. According to the release, quote, "This catalog includes everything from outdoor runs to structured mat class options across strength, cardio, yoga, and meditation from fan favorite instructors Rebecca Kennedy, Ali Love, and Rad Lopez. No specialized equipment required," end quote. That last part is probably the most enticing to me, someone who does not own a Peloton. Glad to hear that there's going to be a variety of classes, not just spin classes. As far as where to find the fitness content, that is an interesting quest. You can either search for the word fitness and click on the genre search result to get to the fitness hub, or you can tap on the Browse All folder icon and choose the fitness category. I was looking for an option that was a bit more obvious. I was thinking a button or maybe a card on the Spotify homepage. Not quite that simple, but it is early days of this new feature. Spotify has plenty of time to play around with where they place this content. And to be honest, I won't be surprised if we see an update to the app layout and design in the coming months. I love that Spotify is branching out and adding value to the service, but pretty soon they are going to need to work on the user experience of their app. We will be linking to info about Spotify's new fitness offerings in our episode notes. If you're sending out a newsletter to your clients or you're posting on social media, this is a great example of content you can share with your clients that adds value, it touches on health, but it does not come across as salesy. Prior authorization continues to make headlines. We talked about changes CMS proposed regarding pharmaceutical drugs a few episodes back. Not long after that, a small bipartisan group from the House of Representatives introduced an interesting piece of proposed legislation as well. They call it the Medicare Advantage Improvement Act of 2026, and it's got quite a mix of suggestions. From my viewpoint, some of these will be easier to implement than others. I mentioned prior authorization, so that is where we'll start out. The proposal calls for streamlining prior auth in Medicare Advantage, capping standard decision wait times at 72 hours. More urgent requests would see lead times reduced as well, calling for those decisions to be made within 24 hours. The proposal would limit extensions up to 7 days in specific circumstances. Another interesting inclusion, matching coverage criteria in Medicare Advantage to that of original Medicare when it comes to prior authorization. And then more calls for automated real-time authorization systems when requests are submitted electronically. in addition to speeding up the prior authorization process, quick approvals, and more transparency around the whole process. Now, it gets interesting when you get into the reporting part of this proposal, especially with the suggested compliance scores. The proposal calls for those scores to be reported publicly, and for companies with compliance scores on the lower end, payment penalties. The new compliance scores would also be a weighted factor in a new category for Medicare Advantage star ratings. Like I said, some parts of this proposal will likely be easier to implement than others. Definitely appreciate the call for transparency. I think that would be helpful. The compliance score suggestion is also interesting, and I think while it could certainly be helpful, another metric could possibly add confusion for consumers. So I'd like to hear a little bit more about how that portion of the program would work. Overall, as I said before, some interesting suggestions. I think we all know that getting all of healthcare digital was going to be challenging because there are so many moving parts. But I also think it's encouraging to see some of these processes get streamlined that can really help our clients have a better overall experience and outcome. The proposed legislation wouldn't go into effect until coverage year 2028, and it does mention an allowance for the Department of Health and Human Services to make changes if necessary. Definitely a good amount of time to work through the details of implementing these types of changes. But also important to mention that this is proposed legislation in the House. It would need to pass a vote there and then make it through the Senate intact. Little bit of a tall order during a midterm election year, given how many seats are up for grabs. But this is a very specific piece of legislation that's worth keeping an eye on. We will be linking to some write-ups in our notes, so you can check out the details and start a mental file folder on that one. Last week, CMS announced an update to their upcoming balance model that we first reported on back in January. CMS published a memo via HPMS announcing that implementation of balance would be delayed, quote, pending further evaluation and data collection. This approach provides additional time and data to inform the potential implementation of balance in Part D, end quote. Balance, to refresh your memory, stands for the Better Approaches to Lifestyle and Nutrition for Comprehensive Health model. CMS had ambitious plans for GLP-1s via balance. Historically, insurance coverage of GLP-1 medication, while popular for effectiveness in weight loss, has been limited to treatment of diabetes. CMS was hoping to increase access to these medications by allowing people on Medicaid and Medicare Part D with other conditions to receive GLP-1s and lower the cost. And this would happen in a model that was voluntary for everyone involved. Drug manufacturers would have to opt in, and Part D plan sponsors would have to opt in as well. Originally, May 2026 was the date CMS wanted the model to start in Medicaid. CMS stated in last week's memo that states could apply to participate in balance through the end of July 2026, with a start date between May 1st, 2026 and January 1st, 2027. States that fail to apply for balance by the cutoff, quote, will not be allowed to participate in the model except at CMS discretion, end quote. On the Medicare Part D side of things, the delay in the balance model means that the GLP-1 bridge demonstration will be extended. The demonstration will still begin on July 1st, 2026, but rather than ending on January 1st, 2027, it will run through the entirety of the 2027 coverage year. CMS is hoping that this extension will, quote, provide Medicare beneficiaries access to GLP-1 drugs and enable collection of data that will allow plans to prepare for the potential implementation of balance in Part D, end quote. Now, we've mentioned it before, but I do want to mention it again. When it comes to both of these programs, neither guarantees coverage for all individuals. I won't go over the specs for the balance model since we're not really concerned with that for the upcoming plan year. But I do want to rehash the details of the GLP-1 bridge demonstration. Think of this as a refresher if you have clients asking about the program. Pricing for the Medicare GLP-1 bridge will be set at $50 per month for eligible Medicare beneficiaries. Participating drugs in the Medicare GLP-1 bridge were recently updated as well. The list now includes Zepbound KwikPen, Foundayo, the Wegovy injection, and Wegovy tablets. The demonstration is available in all states and territories, but not every Medicare beneficiary will be able to access their GLP-1 medication through the bridge payment demonstration. An individual must be enrolled in an eligible Medicare Part D plan. That could be a standalone prescription drug plan, Medicare Advantage prescription drug plan, those enrolled in a special needs plan with Part D, dual eligible individuals enrolled in a Part D plan, and also Part D beneficiaries in employer or union group waiver plans, and Part D beneficiaries in the limited income newly eligible transition program. Eligible Part D beneficiaries must also have a prior authorization request, a prescription for an eligible GLP-1, and meet the clinical criteria. That criteria includes a diagnosis of obesity or being on the higher end of the overweight spectrum. The $50 monthly copay Medicare beneficiaries pay through the bridge will not count toward the Part D deductible or the true out-of-pocket cost limit for either 2026 or 2027. This bridge demonstration exists outside of the Medicare Part D program, other than the fact that participants must be Part D beneficiaries. Some Medicare beneficiaries using GLP-1s for currently covered purposes or via reduced cost-sharing methods will not be eligible for the Medicare GLP-1 bridge. Medicare beneficiaries using GLP-1s for sleep apnea, type 2 diabetes, or other indications covered by Medicare will not be eligible for savings under the bridge demonstration. And that's even if what they pay for their Medicare covered conditions is more than the $50 copay an individual would pay through the bridge program to cover treatment of obesity. Same story for Medicare beneficiaries with a Part D low-income subsidy. If they already qualify for reduced cost sharing, they can't then apply that savings to GLP-1 medications through the Medicare GLP-1 bridge demonstration. Also, keep in mind that because the balance model requires Part D sponsors to opt in, there are some reasons to be cautious about the GLP-1 bridge demonstration. A beneficiary could gain access to GLP-1 medication through the bridge demonstration and then not have access to balance when it launches, if their Part D plan sponsor chooses not to participate in the program. Little bit more to consider moving forward here for your clients. And then on the Medicare side of things, remember that CMS allocated funding for this demonstration through the end of this year. It's currently unclear where the funding for the program would come from in 2027 and what that change would bring to the Medicare program. Lots to keep track of with this and just overall in general with the entire industry these days. That is why we recommend following along with our podcast to stay as updated as possible on everything that's happening in our industry. As you're looking through the episode notes, we would love it if you would follow along with our show. Then that is one less thing that you have to seek out. And as we head further into spring and then summer, we will have even more timely news and information to share, like certification timings, first looks, all that good stuff. But for now, that will do it for this week's episode. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.